Welcome back to EdLab. Autism often exists alongside other co-occurring conditions, such as difficulties with sleep, or for some, depression and anxiety. For individuals with autism seeking mental health care, healthcare providers often have several tools in their treatment toolbox, but most of those have primarily been tested on individuals without autism. So questions remain as to which treatments actually work best for members of the autism community. Our guest today is on the hunt for some answers. EdLab is a podcast of the University of Virginia School of Education and Human Development, where we talk to the people behind the school's transformative research, innovative teaching, and thriving partnerships. And in each episode, we aim to demystify some of the big questions being asked in education, policy, health, and human services. I'm your host, Audrey Breen. Today's guest is Micah Mazurek. I realize on every episode I say how excited I am to speak with each guest, and I legitimately am. Micah Mazurek is a clinical psychologist. She is the Novartis U.S. Foundation Professor of Education and Director of our Supporting Transformative Autism Research, or STAR, initiative. Micah found her calling in graduate school, working with children with developmental disabilities, including autism. And ever since, her work has focused on expanding access to care for those with autism and their families. Welcome to the podcast, Micah. Thank you so much for being here.
Well, thank you for the invitation. I'm really excited to talk to you today.
Awesome. Okay. You are here. You are doing your scholarship and have been now for a good while at the UVA School of Education and Human Development. Tell us a little bit about how you got here.
Well, I'll try to tell you the story without spending too much time explaining it all. But I think I grew up in North Carolina, so taking it way back to the very beginning, in a really small town in the Appalachian Mountains in Ashe County, North Carolina, which is in the northwest corner of the state. Okay. Really beautiful part of the country, very close community, very small community. Not a lot of resources compared to most other parts of the country, I would say. Yeah. And I loved growing up there. And had the opportunity to go to Yale University for college, which was really eye-opening. I went there on scholarships, so I kind of felt like a fish out of water when I got there, for sure. Yeah. I had originally, growing up, wanted to be a veterinarian.
Oh, really?
I love animals, and that was kind of my plan.
Oh, no way.
But when I got to college, I took my first psychology class when I got there, and it just kind of opened my mind to this field of psychology and thinking about how the mind works and that there are things that we can do to improve development and kind of understand how people think and how people interact with one another and all of those things. So I got really fascinated by that. Yes. And I had some opportunities to volunteer and work in labs, really focused on child development and kind of understanding how children develop and how things that happen to them really early in life can either be risk factors or there could be some resilience factors that help them have better outcomes. So I really fell in love with the field through those experiences and decided I wanted to go to graduate school, focused on children primarily, and also clinical psychology. So thinking about both the science of understanding how people think and learn and develop, but also really applying that knowledge to developing interventions to help them promote better outcomes. So I ended up going to graduate school at the University of North Carolina at Greensboro and really focused again on children's social emotional development with more of a clinical psychology lens. But it wasn't until I went to internship. So for clinical psychology, you need to do a 1-year clinical internship as part of your doctoral training. Okay. And I did my internship at the University of Alabama at Birmingham, which was within a children's hospital setting, but also offered opportunities to really focus on developmental disabilities, including autism. And I had not really had exposure to kids and families with disabilities before that experience. And I really just fell in love with that population. And there are so many needs, I think, for support for children and adults and families with disabilities, and just a lot of barriers and unanswered questions that they're struggling with. So I found my calling, I would say, through that internship experience. And then after that, I went to postdoc at the University of Missouri, where I was really fortunate because at the time I arrived, they were starting to plan a new center for autism there at the university. And so when I finished my postdoc, I was hired on as faculty just as this new center was developed called the Thompson Center for Autism.
Okay.
And it was just a wonderful place to be because the center was designed to be an interdisciplinary center that integrated research, training, and services across many different disciplines so that families could come and have kind of a one-stop shop to receiving care. And then research and training was kind of integrated there as well. So just a great place to be. And my work was both clinical and teaching and research in that faculty position. So we saw children and families for diagnostic assessments and then providing intervention supports for them after the assessment as well. And while I was there, it really struck me how barriers to access can just make a huge difference for families. We were the largest and maybe the only autism center in mid-Missouri for sure, but the largest autism center in the state. And so families were waiting months and months and sometimes years to come and see us on the wait list. And they would need to drive 4 or 5 hours to get to us.
Wow.
So it was really striking how we could provide best practice care, but there were all these barriers for people to get access to help in their own communities. Some of my work really started to focus on access to care at that time. So I, loved my work there, but then there was an opportunity to join the faculty here at the University of Virginia and to help launch a new autism initiative here, which was exactly, I think where I needed to be. And this has been, I would say, my dream job since day one. So I moved here in 2017 and have been here since that time. And in that time, we've launched an initiative called STAR, which is focused on building and supporting infrastructure for autism research and training and outreach here at UVA and more broadly across Virginia. So
we are so glad you're here. I would love to talk a little bit about the barriers and what does that mean for individuals and families with autism? What does it mean when they can't access diagnostic care in a meaningful time or, they are inhibited by travel costs, time away? What kind of impact does that have on an individual and a family?
It can really have very significant and long-lasting impacts. We know that autism is a neurodevelopmental condition, so it affects the way your brain develops from really early in life. Mm-hmm. It makes some things more challenging for you when it comes to social interactions and communication. And so there are evidence-based interventions that we can start very early that can help someone learn the skills they need to be able to communicate more effectively, learn daily living skills and all of those kinds of things. But the earlier those interventions start, the better the outcomes. And that's because the brain is really poised to benefit the most at very early stages of life. So we're sort of in a race against time to get children diagnosed as early as we can. The first signs of autism emerge in the first year of life. So we can start to see those differences and we can make valid diagnoses in toddlers. But across the country, the average age of diagnosis is between 4, right around 4.
Okay.
And it's even much later than that in a lot of parts of our country where there are fewer resources, like the area that I grew up or in Missouri when families were living in these rural areas.
Yeah.
So I think for some people that age is much later. And so that means that children aren't able to receive the interventions they need at the time when they need them.
Yeah.
So that has downstream effects. And then for some people, I would say some folks aren't diagnosed until even way later than that, even in adulthood. And so that means that for most of their lives up until that point, they didn't have a good understanding of why they were struggling in a certain area, or they didn't have access to the supports they need to help them really thrive.
Yeah.
So
you've kind of answered this question with a couple of these data points of the average age being 4. We are seeing, adults diagnosed with autism. What is the picture of autism? And then I would like to specifically ask, about what some of the specific questions you're asking right now in your own scholarship.
So in terms of the prevalence of autism, we can start there. That has increased really dramatically over the past several decades. 20 years ago, I think it was a prevalence of 1 in 150 people being diagnosed with autism in the United States, and now it's up to 1 in 36.
Wow.
And so those are estimates from the Centers for Disease Control. That means that all of us either are affected by autism ourselves, or someone in our family, or certainly somebody in your community that you know really well. So it's more and more common.
Yep.
And so more and more people have questions, they need supports, and they have a lot of needs for understanding and access to care across from education to healthcare and mental health care services.
Can you maybe offer some context into why those numbers have changed over the last couple of decades?
That's really the million-dollar question, I think. A lot of that has to do with changes to our diagnostic criteria.
Got it.
So many years ago, our criteria were written in a very strict way so that people with very clear-cut presentation of autism features would meet criteria.
Got it.
And then over time, they expanded the criteria to be able to capture people who had difficulties that were not quite so significant.
I see.
And so we're now able to diagnose more people under the diagnostic criteria that we have. And we've also done a good job of improving awareness and understanding of autism. So I think more clinicians are able to identify signs of autism than before.
That's great. Let's talk a little bit about what questions you're pursuing. There's a lot from which we can choose. But I would love maybe if you could pick 1 or 2 of kind of the questions you're thinking about at the moment and what some of your scholarship is centering on.
Yeah, let me think if I can pick 1 or 2. My work focuses on a few different lines. So I have some work focused on developing and testing new tools for diagnosis to really improve our ability to make diagnoses more effectively and more efficiently. I'm also really interested in understanding mental health because co-occurring mental health challenges are really common for both autistic children and autistic adults.
Got it.
And they have barriers accessing care for that as well. I have a lot of other kinds of lines of research, but I think those are the 2 that I'll share a little bit about.
Let's talk about mental health. And you mentioned co-occurring, that mental health is a co-occurring, or mental health needs, I should be specific, are often co-occurring conditions. Let's talk a little bit about kind of what co-occurring means and kind of what that is, and then maybe some of the specifics you're talking about around mental health care.
Sure. Yeah. So when we make a diagnosis of autism, we're focused on understanding the characteristics of autism itself. So how the person is processing information and their social and communication and behavioral presentation. But many people with autism experience difficulties with mental health conditions like anxiety or depression. Those are 2 of the very common conditions that can co-occur with autism. And also sleep problems and insomnia are not specifically mental health conditions, but they certainly affect mental health.
Sure.
And they are very common as well for autistic children and adults.
Interesting.
So those are when you go to the community and ask autistic adults and family members, what are your top priorities right now? What do you need the most help with? What do you think research should be focused on? Mental health is often either the top request or at least the top 3 in terms of needs. So it's a really important issue, and I think it's been understudied and underserved in our kind of services that we're thinking about for autism.
So how are you tackling this?
Yeah, so we have several different kind of approaches to this. Part of it includes really engaging with the autistic community to learn what their experiences are, what their priorities are, understanding both their needs in terms of needs for support and symptoms that are getting in the way for them, but also their thoughts about strategies that they think would be most effective for them or adaptations that might be helpful to traditional strategies for mental health. So one of the questions, there are a lot of evidence-based therapies to address mental health challenges. And I'll just add as well that when we're doing this priority setting work with autistic people and families, they oftentimes overwhelmingly request non-medication-based treatments because of the side effects and other kind of negative outcomes of medication. So if there are alternatives that work, they're very interested in knowing that. And so we as psychologists and mental health providers and therapists have kind of a lot of tools in our toolbox for things like anxiety and depression. But those treatments have been tested primarily in non-autistic samples. And so we know they work for children and adolescents and adults without autism.
Right.
But there's a lot of unanswered questions about how well they work within the autistic population.
Got it.
And so when you are a client or a patient looking for a treatment or a provider, you may not know what to ask for or what kind of experience that your therapist should have. And if you're a therapist in the community and an autistic client comes to see you, you may not know which treatment would work best for them.
Right.
So one of the studies that we're doing right now is to compare two of the most evidence-based treatments for anxiety and depression to one another in autistic clients with anxiety and depression. So by the end of that study, we should know which one works better for most people, and we'll also be able to understand a little bit more about the person's personal characteristics that might make one of the treatments more effective for them.
Yeah. Each of these conversations, we often return to this idea of partnerships, and you've already talked about really beginning many of the questions you're asking around your research, beginning those with conversations with people in the autistic community. Can you talk about how partners, really what kinds of partners are a part of your research and how they contribute to your scholarship and even broader at STAR, if you want to talk about that?
I think partnership is probably the cornerstone to our work and really a critical element to everything that we do. For STAR, our work really did begin with gathering input from the community, meeting with key stakeholders across different kind of identities, from autistic people, families, teachers, healthcare providers, to understand the landscape and to understand the community and what their main questions and priorities were. And we've tried to do that across time regularly, just in general. And then for our specific studies, we oftentimes have advisors or partners who are community members that are part of first developing a question and then, deciding what research to do. And then in some of our studies, we have autistic partners and community members who are also part of the research team that help us ensure that our materials are autism friendly, that we are using affirming approaches across the research design. So I think we sort of have community partnered elements of our work from the very first point of asking the question to designing a study. And then once the study is done, we want to share that information and disseminate it in a way that people can use it. Right. So that was kind of a long answer.
Yeah, no, I love that. And I think about sort of this continuation of care. I feel like so much of the work that's happening in STAR is really listening to, collaborating with, and making those connections because there are so many different points of contact on the care spectrum for individuals and families with autism.
Absolutely. And I think a key challenge in our field is that there are critical shortages of providers and practitioners with training in autism across fields. Okay. So that includes education, mental health, physicians, primary care. Yeah. Almost every field has very limited professionals with training in autism, and there are really few autism specialists. And those resources tend to be, they're just very unevenly distributed. Mm-hmm. They tend to be clustered in urban areas or
Right.
near academic medical settings.
Yep.
And most people in the country don't have access to those specialists in their communities. So I think that's a grander challenge that we're
Yes.
facing in a lot of our work. Focuses really specifically on building capacity among community members and community-based professionals.
Yeah. I would love, I'm throwing you a curveball. This was not on our question list, but thinking about really expanding access and the network of knowledge around autism. Can you talk a little bit about the ECHO tool?
Yeah, that's a model that was developed at the University of New Mexico several years ago to improve access to care for patients with hepatitis C, who had a similar challenge of very limited specialists in the state, very long wait lists, and poor access to care. So this model was developed to really train community-based providers to take care of complex conditions. In that case, it was hepatitis C. And so when I was at the University of Missouri, I collaborated with a pediatrician there whose name is Kristen Soul. We were very close collaborators at the Thompson Center, and we heard about this model called ECHO, and we thought this could be our answer for our challenges with autism, access to care. So we tested it out in a pilot study there at the University of Missouri, and then it worked really well. So we've been building on that and iterating on it since that time. And the way ECHO works is that it used Zoom before Zoom became cool during the pandemic. So,
Zoom user.
So basically it connects an interdisciplinary team of experts with community-based providers. And so because it uses Zoom, there are no geographic barriers to accessing it. And so it develops a community of learners who meet regularly over time. And we train them in best practices in caring for children or adults with autism. And so each session has a little brief didactic where we're teaching a topic, but most of the session is case-based. So the providers share de-identified cases from folks in their practice, and they get immediate coaching and feedback from the expert team, but then everyone in the community is learning from each other. So they may hear something that applies to cases in their own practices that they can go back and apply. So it's instead of a one-to-one kind of consultation model, it's a one-to-many because those providers are then equipped with knowledge that they can use to take care of all the patients in their practice or all the students in their classrooms. So it's a really nice model for building capacity.
That's very cool. We've been wrapping up these conversations with a question about the future. Let's pretend it's 10 years in the future. We've returned. We're still doing this podcast. What do you hope we know in 10 years that we don't know now?
That's a really hard question. There are so many things that I hope we know. There are so many unanswered questions. I would say, I would hope that in that amount of time, we really have a better system for equipping communities to be inclusive, welcoming, and supportive of autistic people across the lifespan, from children through adulthood. And that we have just a more connected system, because I think children and adults and families oftentimes feel isolated, and they feel like they don't really have a roadmap for where to go or who to turn to, and those people aren't really talking to each other. So if we had a connected, collaborative system of support, I think that would be, ideal.
That's great. Well, I am so grateful for your work and thankful that you took some time to talk with us today. And I really hope you come back, because I know we have only sort of touched the proverbial tip of the iceberg. There's so much incredible work that you and your team are doing. So please do come back.
Thanks so much, Audrey.
It was good to talk to you. Thank you. EdLab is a production of the University of Virginia School of Education and Human Development and WTJU 91.1 FM. EdLab is produced by Audrey Breen with support from Mary Garner McGee and Sage Tongwe. Our music is Palms Down by Blue Dot Sessions. You can subscribe to EdLab wherever you listen to your favorite podcasts.